Shalom and good evening and good morning and good afternoon. We are international and global here on TMS Roundtable Recovery. My name is Dr. Tovah Goldfine. Here each week, if some of you are new to the Roundtable, we stream live weekly. We've been doing streaming live for 7 years. And as I always say, I'm not slowing down. I will go weekly with the help of someone like Jeannie on my side for the rest of our lives. So what's happening here on the Roundtable? It's so exciting. We meet doctors and health professionals and physical therapists, doctors of physical therapy like our guest tonight. And we meet authors and movie directors and scientists, and we have lively discussions, live Q&As, inspiring, educating, bringing resources to many, many people with chronic pain and autoimmune disease. Most importantly, we meet people that are on their healing journey or who have recovered, and they meet us and we're talking about what they did, how they did, what motivated them, what doctor they worked with. So we're constantly talking about this from the doctor's therapist end, from the client patient end, and it's nothing short of inspiring for me and Jeannie. We meet people with all types of diseases, from multiple sclerosis, which I've often mentioned my own mother had, to arthritis, to all types of chronic pain, all types of neuroplastic and chronic pain. And we're meeting people like I spoke with my guest before the broadcast started about the science and the art of healing. So joining me tonight is my co-host is Jeannie Kulwin, and Jeannie joins me about once a month here on the Roundtable. She is a mind-body healing coach who spent over 16 years in chronic pain. That is not easy. Healing chronic fatigue and fibromyalgia before discovering the neuroplastic and TMS principles and recovering completely. Jeannie, so glad you were here with me tonight.
Thank you.
I always breathe a little easier when Jeannie's here. Today, we have as a guest Dr. Sharna Prasad. I met her through Dr. Hanscom's podcast, so he's got all sorts of exciting guests, and then they sort of hop onto my broadcast. Dr. Sharna is a licensed physical therapist, a public health professional, and self-described Painiac. First time on the Roundtable, a Painiac who knows chronic pain not just from the clinic, but from the inside out. Dr. Sharna's own lived experience with chronic pain and her journey to mastering it became the fire that drove her deep into the science of healing. Now practicing in rural Oregon, where Dr. Becca Kennedy also works, Dr. Sharna works exclusively with complex chronic pain clients and is pioneering something truly exciting: shared medical appointments that bring together lifestyle, medicine, trauma-informed care, and the social determinants of health into one powerful group healing experience. She's also a therapeutic pain specialist with extensive training in acceptance and commitment therapy, and someone who genuinely believes that shared humanity in a group setting is one of the most important pillars of recovery. And isn't that just science in a nutshell? So, Dr. Sharna, I'm so happy you carved out your schedule to meet Jeannie and I. And how I like to start this is just, like a timeline. Our listeners would love to know a little bit about you, how you met your chronic pain, how you recovered, and how you got into this with obviously the passion that I'm seeing all over you and your website. So welcome and thank you so much.
Well, thank you, Tova and Jeannie, for hosting me. I really appreciate that. And it's kind of exciting to share my journey with you guys. So I have been a physical therapist for 39 years. I went to PT school in India and then came to New York to study and then got my doctoral. So I've been a PT for a very long time, but we're very biomechanical therapy, body. Was struggling. I never looked at it beyond the body. So until I had pain myself, I had severe low back pain, enough that I would crawl out of bed and it was just agonizing. I knew I had to exercise. So I would crawl out of bed, go to the gym, and then go to work. And I was this was around 2013, 2015, and nothing was helping me. Everything I knew as a physical therapist was not helping me because I was trying everything. But I was keeping it very quiet. It was in isolation. I was suffering. And that is when I was introduced to a physician. He was a pain specialist, Dr. Kevin Kokaro, a local physician. And I was like, well, I know all about pain physicians and their interventions and all that. And he says, I don't do that. And I said, well, what do you do? She says, I teach people about pain. And I'm like, what do you teach? What is there to teach about pain? But anyway, he and I met once a month for a year, but I couldn't understand what he was trying to say because he didn't belong to my tribe. He was not a physical therapist. He was a physician. We were not completely aligned until I went to a conference, and I was sitting at that conference, sitting with my peers because I was suffering. I was in so much pain that I was looking for answers, but I wasn't finding it. And then I'm sitting in this conference, and the speaker, Adrian Lau, he was a PT, PhD. I'm sitting with my peers, and he asked the question, what is pain? And I'm like, that's a dumb question. Everybody knows that damage, you get hurt, you have pain. Hurt is pain. And somebody from the audience said, pain is about protection. And I'm like, no, it's not. And of course, he validated him and not me. And I was just like, what? Pain is about protection? When did this happen? And how come I have been in the profession for so long? And how do I not know about this? So that became my pivotal point. And I said, oh, that is what this Dr. Kukaro has been trying to tell me. And I am just blindsided. I couldn't get what he was saying. So then it started my journey into learning about it. I had a company where I started inviting speakers from all over the world in Portland to talk about pain. And they were all international speakers and this and that. And I was just like, and then I started a Oregon Pain Conference, or Oregon Pain Summit. And we did that for 5 years. So it was like, get out of my way. And so not only was I teaching myself and learning about and of course, in my personal journey, what I realized while I'm sitting there and saying, what's pain protecting me from? I realized that I had a lot of stressors in my life. I was raising 3 teenage kids, and I didn't realize how I was conflicted. I was born and raised in India, and I came with Indian values, and I was raising American kids. And, they, as Indian parents, we were like, oh, they should be in the sciences and robotics and, spelling bees and, geography bees and whatever. And my kids were not. They were American kids. They were doing cheerleading and they were doing basketball and leadership. But I was not accepting that, or I was accepting it, but I was conflicted. But I didn't realize that conflict could show up on my body. And I was also stressed out at work. There was a lot of stressors at work. So I was like, oh, these factors can be contributing to my pain. My pain body is not broken because I had no injury. I had no injury, but my brain had gone to this frenzy of, oh my God, I have cancer or I'm going to die. My pain's not getting better. I would not see a doctor because what would the doctor say? Go see a physical therapist. Well, I was the physical therapist. So anyway, that was my story. And then there was no stopping. So I said, 6 months later, I was pain free by working with movements that I was telling myself, this is not safe. This is not safe. And I said, you know what? Let's graded exposure. So I went through that.
Wow. Wow. So your brain was protecting you from some unconscious thoughts of conflict between your being a mother and being like and Jeannie's was a teacher for many years before she was a coach. So she understands about, children and schools and whatever you're going through. So would you say that your brain was protecting you from some unconscious repressed feelings, more or less?
Yes, definitely.
Wow.
There was a major conflict, war going on internally that I was not aware of, but my body was. You see, my the repressed emotions, the repressed thoughts. I mean, the thoughts were there, the emotions were there, and my body was just, I was not paying attention to my body. And so it was a very big learning process for me to accept my body the way it was and say, you know what, you're safe. The safety was the biggest thing, and connecting with my body was the big thing. And I think that journey just took me to where I am today.
So I know for me and many of my clients, we don't realize how much stress we're in. I mean, when I started seeing the traditional doctors, when you're in stress and fight or flight for so long, that's just normal. You don't even think it's unusual. So I wanted to hear, that's my first question to you. Were you also in denial that you were stressed, or did you recognize it? Because a lot of us don't even recognize it.
No, there was no acceptance that I was under stress. I was in complete denial about
Okay.
it. Was my body was hurting, and this was a different part of my life. How was this two connected? I was not able to see that at all until I started understanding the science, and I'm like, wait,
Yeah.
what? That how can so because it's our training, it is our training as physical therapists. We are taught the human body, and we are not taught about a lot of the emotional stuff. I mean, I am really, really hoping that our education system is changing for healthcare providers. And I am seeing some glimpse of it, but being this mainstream is not going to happen for a very long time. So yes, you picked up on very right. I was on this side
I
with
think
my
a lot of
body and this
viewers,
side with my yeah.
yeah, I think a lot of viewers and people living everywhere, we don't realize the stress. And then the other thing, because I've talked to other PTs and my coach was a PT, Jim Prusak, talking to a lot of these PTs, the way I understood is that you're trained that there's pain because the muscle is weak, right? So PT, so they told me years of that, years of training. So how is that correct? And then how did your brain, when you have years of training this way, how is it for you to shift? Was it pretty easy or was there resistance?
So I am, I'm a very strength based coach. So I don't tell my patients that they are weak. I might notice it that they have certain weaknesses in certain muscles, but I don't share that with my patients that much. I will integrate that into their functional exercise. So, for example, a patient might come to me and say, I have difficulty picking up my grandson, Johnny, from the floor. So, and I will evaluate them, and I might notice that they have certain weakness in their quads and their hamstrings or whatever I find in my assessment. But I will not tell them that, you're necessarily weak there. I'll just integrate it into the movement and say, in order for you to pick up Johnny, these are the exercises we need to work on
Mhm.
so that your body gets fit enough to pick up Johnny. So I keep that weakness, limitation of movement, all those assessments that we do as a PT in my head, in my notes that I need to work on that. But I don't necessarily tell my patients that. So I average 5 visits with chronic pain patients. So it's really very. I feel very. I feel very. I'm in a very grateful place, a practice that as a physical therapist, I'm able to practice that level of complexity with my patients. I feel like I have cracked the code, and I don't say it in a bragging way. I say it with a lot of humility that it's taken a long time to get to where we are.
Yeah.
Well, it's important, and this could be another a whole broadcast, and we've touched the topic about the power that clients, patients give the doctor or the therapist, the power to, you know, make them feel better or worse. That's the relationship they have. So the relationship with you is very powerful, very important. And if they can trust you and you can mirror to them even the words you say, it's so important in that relationship when you're telling them what they feel, what's going on. Like they're looking to you for advice. And of course, people like you, Jeannie, and I, we want to empower our clients because we don't want to be the authority, and we're always saying like your doctor's not God. And it's really important that you have this, your thinking about your client. You're thinking, hey, this is a sensitive, person. We're all sensitive, and they're dealing with chronic pain, and there's a huge emotional component here. So the awareness you have and the sensitivity, you know, we're meeting doctors in our field who are like this. And what I guess our hope is that we can continue to educate the doctors in the medical model to, to be more sensitive, to be more aware, to be careful of their language. And there are many and many. It's changing as we speak the profession.
We could have an all-day conversation on that topic itself. What you just said, the word I use is nocebo. You have the word placebo and nocebo instead
Yes.
but I don't like big words because I like to speak at a language of sixth grade and lower, but nocebo is a higher level word. So it's the words that harm us, right? So we can, and what you said about the power dynamics, right? The patient is coming to you with hope, with they're very vulnerable. They have had a lot of medical trauma because they've gone to doctors and they've told your MRI was negative, your x-rays were negative, we cannot find anything wrong in your labs, your pain is in your head, right? So when they're coming with that distrust of medical profession, it becomes very critical for us to be in that dance. We talked about it earlier. It's like we're not wrestling with them. It's a dance. It's a ballroom. We're just one step forward, one step back. We're just in that space. So and I say that. I said, who is the expert of your body?
Wow.
Who's the expert in your body? You're the one who has lived with your body for 20, 30, 40, 60, 80 years old, 80 years. I have met you 10 minutes ago. I may be expert in the literature and the research and the information I have learned in my process, but I by no means am an expert in your body. So if I tell you, do this exercise, and your body says, no, that is painful, please don't do it. I will give you, this is my profession. I have done physical therapy for 39, 40 years. I can give you a million exercises. So if that exercise hurts you or your body says, I can't do it, please listen to you. You are the expert. And come back and talk to me that this didn't work. And we will change it right away and we'll give you something else and we'll work with you. So that's my take on that.
Well, that's a great gift. It's a great gift that we can give people that power. And some of them don't want it, but you know what? People like you, myself, and Jeannie are like, okay, you're taking the power. We're going to sit here and we're going to wait until you're ready to take your power back. My logo says finding the doctor and therapist in you. And some people are like, I don't want that, doc. And I'm like, So I want to shift things because it's very important, especially to talk with Jeannie and Dr. Sharna about this. So it's what I want to say is you're working with CRPS and FND. Is that what it is? Functional
neurological disorders.
Yeah, and I want to. These are topics that we're seeing on the Facebook, in the Instagram, we're seeing in the field, and a lot of people are. I've met many that are healing and in recovery from these chronic pain, complex pain syndromes. And I just want to put out to the people that may not be listening to this broadcast, but that if they know anybody, that people can be in recovery. Maybe you can just chat a little bit about that with your practice. And that's your practice in the hospital. And Jeannie might want to mention if she's met anybody with some of these more complex, because I'm not seeing them as so drastically different regarding the neuroplastic work, regarding the Laura Mosley work, regarding the David Hanscom work, that they can use this work, apply it, and recover. So could you chat about that part of your practice, and then we'll chat about your private practice with
So
pain.
I agree with you that the treatment or the process is not any different. So the absolutely not. Just because we have a different diagnosis, it's more widespread. The management remains the same. It
Yeah.
still has that the body is, you have an exaggerated response to a stimuli. The pain is very severe, and you can also have darkening of the skin, and inflammation and swelling, and absolutely. So that is all your body is gone into protection, and there's so many contributors. So the word I shifted from was causes. What is causing your pain versus what is contributing to your pain? And that was very pivotal also, because people are like, oh, so what is causing it? What is causing it? And I was like, what's contributing to it? So I can
Mhm.
share my story, and I've shared that. It's like my kids, my work, my my beliefs, my past experiences, my culture. They are all contributing to my pain experience today. And we're looking at epigenetics. We're looking at what happened to me and what experiences I've had coming to this date is all in my body. What has happened to my parents? What has happened to my grandparents? That is all present with me right here, right now. So it's a very complex, multiple contributors to your pain experience. So
And
that's
and
how
would
I
you
explain
say
it.
would you say the cause would so you're saying that's the contributors, but the cause is in the brain. Is that how you wanted to? I was
I
waiting
don't
for
use the
that.
word cause. The cause is a
Okay.
banned word in my vocabulary. I
Okay,
don't even use
good.
the word.
I like that. The contributors, I love it. It's very, very good advice for us, even the perspective. Jeannie, what do you think about that?
Yeah, I mean, I agree. I think when I've seen FND and CRPS, I'm definitely seeing it with a lot of different diagnoses. So very rarely have I seen I just have this. It's like I have this, I have this, I have this, many, many things. And to Dr. Sharna's point, we're looking at, I call it the root, right? We're going to like the root sources, what's contributing to it, the stress, the emotions, the trauma, all of the personality traits. I think people would be surprised, and I love that you're saying it, that what exactly you have and who you work with, and if they've had exactly the same thing. I think people are getting really hung up on the symptoms and talking about them and analyzing, and we need to work, to Dr. Sharna's point, with to the root or to the contributors. And that's so
And
interesting that
yeah, yeah.
this is happening. Yeah.
And this is me on a limb, and I would love you to say you disagree, because we can all disagree, agree to disagree and not have a war.
I know.
Okay,
I agree.
so we women could run the world. We know that already. But anyway,
We definitely
um,
could.
so but I would say that it's your relationship with these people, places, and things that is really where the solution is. What do you feel about that?
Absolutely.
And with
Everything is
ourselves. Yeah.
sorry. And it's
And with
every
ourselves.
exactly, Jeannie. It's everything is relational, right? Your relationship with yourself is the first relationship, right? You Our family structure kind of messes with that relationship sometimes, depending on what kind of experiences we have had, what kind of culture we've grown up with. So it changes our relationship with ourselves. So that is the first step of work, right? That place of self-compassion, that you are here right now. This is your world. And then the kindness you can bring to yourself, and that knowing is a shared humanity, that we are not alone in this journey of ours. And these are the factors that I think are very critical in the healing part
Yeah,
for our patients. Yeah.
yeah,
So
very,
it's
very
everything is relational, Tovah.
beautiful.
It is absolutely
Yeah,
relational.
yeah,
I
important, and
agree with
that's
you.
where people that's the power. That's where people have that power in them, that innate intelligence, which is the relationship with the body. And anyway, it's another great topic. So what I would love to shift to is to talk about our title, which is why some people recover and some don't. And those people who aren't recovering are just on their journey, because everybody can recover. It's possible and probable. It's almost like that scenario where God keeps throwing the anchors. You know, you're in a boat and you're drifting, and he keeps throwing. A plane comes, and the person in the boat says, "No, I'm going to catch the next, plane, or I'm going to catch." So God will keep throwing the anchors, and we will they'll keep being the recovery options. But when we said, why are some people stuck? Some people are on their journey. Some people are getting that book cure. But let's talk about your experience from your private practice with work you're using, more of the neuroplastic methods, and what other else things you're doing, the shared appointments, which is a beautiful concept. We should talk about integrating the medical model with your neuroplastic model, which is so important in today's world. And you as a medical person, how you brought together with such harmony, what we call the neuroplastic model. And so share with Jeannie and I and the listeners what you're doing in your private practice, and also that I wanted to let people know that you're available on your website. It says that you can speak with Dr. Sharna for a short discovery call, a short call. But you have a private practice and you're working with people in chronic pain,
So
correct?
I'll use my example. When I met with Dr. Kukaro for a year. I had already suffered with pain for 2 years, and I was not ready to do the work, or I didn't know what to do, right? So there was that resistance because I was not ready. Like the time was not right, or I hadn't met the right guide, or so I'm going to take a detour.
Please.
In India, I come from India, so we use the word guru a lot. A guru is in the Western world. What do you guys understand as a guru?
Well, I was into a guru when I was 17, and my parents freaked out. I was following this guru because he was giving this incredible knowledge, and I realized he was saying what Jesus was saying. He was saying what Moses was saying. He was saying what the Buddha was saying. He was speaking from this place of love, and I was just drawn to him because I was searching.
Yes, yes. So that is exactly what a guru is. And Jeannie, how do you understand a guru?
I mean that, but then I think there's been a lot of negative stereotypes of that word because of things that have come out in America, unfortunately. Yes.
Yes. So I wanted to hear that part, because that is how the Western world sees gurus, is the person Mr. Know-it-all. You put them on a pedestal and it's a know-it-all. But the guru is a person who removes the darkness of ignorance.
Oh.
So sit with that. So in Tovah's example, she was searching, and this person was giving her the light that she was looking for.
The knowledge,
The light, we're in darkness, right? So in pain, when in my world, I was in darkness of not knowing the science, not understanding that the body and the mind are one thing. How on earth would we think that they are separate? So how's the nervous system and the skeletal system and the endocrine system and the immune system and the neurological system are all connected? How can you even think that this is separate and this is separate? And so that was my darkness. So for me, I had a lot of gurus who came in my life who changed my life personally in my chronic pain. Dr. Kukaro was one. Adrian Now, who I mentioned, was one, because I started taking his courses. And then there were a whole bunch of other people who came in my life. And then I became that person that when people come to me. So the other piece of a guru is only the student can identify their guru. So in Tovah's case, she was the student who identified her guru, right? Jeannie's example was that I am the proclaimed guru. That doesn't work ever. So I could be the guru for a patient, and Tovah could be my guru for something else that she does, how she runs podcasts and whatnot. So you see, we can be each other's enlightener. Like we can enlighten each other without and only the student can identify their guru. So I'm very picky about my teachers and my gurus, that, if I want to learn how to sew, I'm going to go find the best person who knows how to sew, or so on. So in my practice, that is how I have a poetry, but I can't say it right now because I don't have it in front of me. But I use that all the time, that I'm not here to fix you. I'm not here to heal you. I'm here to walk with you in your journey till you find your light. That's
Beautiful.
all I'm doing.
Oh. Can I just say, as someone who spent a long time, as you both know now, putting all my faith in doctors, the medical system, the drugs, right? The medication's going to save me. The IV fusions are going to save me. I just love our community and this approach, because that's how we view it. We're walking alongside with you. You're the self-healer. It just takes all, it's all about empowerment. I've just been obsessed with that ever since I got into this field. And we're not healing you. I mean, I literally, I live in LA. I went to many healers. That's what I was looking for. Heal me. I have no idea what to do. And putting my power in that was there was many, many things that were wrong with that. So I just love this.
There's many things wrong with our health system, and we can go that route, but I don't want to, because we're spending so much money in America and on our health system, and we're just chasing our tails is what we're doing.
Yeah.
And the amount of, $650 billion is being spent in just treating chronic pain. It's a leading cause of disability, and we're not able to put that a priority. We are not able to change policies. I mean, I can go on and on.
Me too.
But I don't think we need to. So that is why what I believe in, I see the big picture, and that is always there behind me. But I have to do my share as a healthcare provider, because I took the oath, and I feel like I have to do my contribution, and whatever that is, population health, patient empowerment, reducing costs. And that brings me to my shared medical appointments. That's my solution to a very complex problem.
So I just want to say, in answer to our title, why do some people recover and some people don't? I think number one is finding the right partner, the right coach, the right partner. And sometimes it takes a few falls and gets up and falls and gets up. Sometimes it takes a little bit of extra money, but to find the right person who's ready to guide you on your journey. And number two, this shared appointment, which is, I would call collaborating, or maybe correct me if I'm right or wrong, like using your medical doctor with your PT, with your neuroplastic coach, like this collaboration between sometimes a few coaches to help you find what you need, because it's not a cookie cutter. It's not, we're all good at certain things. Is that what the shared appointments share that with the audience?
So there's a big backstory behind it. So I started, when I started understanding pain, I started going into the high schools and started talking to the kids and saying, hey, you got to understand pain. And this Gen Z community was so ready. They wanted to hear more, and they were like, oh, we get it. So I asked a 14-year-old kid, I said, what is pain? And she says, what do you mean? You mean pain when I twist my ankle playing volleyball? Or you mean pain when I am when I broke up with my boyfriend, or pain when I am bullied on social media? And I'm like, oh my God, biopsychosocial. These kids get it. And I loved, I would spend my 90 minutes on my days off in a school talking about pain and, how to prevent the opioid epidemic. It was my single-handed effort into changing the opioid epidemic. And then the other school, got wind of it. So I started going over there. And then it was fun because my son used to play basketball in this school, and they had all these other basketball players. So we talked about, so it was such a fun time. But then the teachers came back to me and said, Sharna, we need more. And I'm like, I can't give you more. I'm all my days off. I am volunteering my time in the high schools. I cannot give you more. So we applied for a grant, and we created a curriculum, and we started teaching the teachers, and we started integrated it into the school curriculum. So, but we did not have a sustainability plan. So, I am a strong believer in failure, because I feel like when you fail, you learn so much from it, right? So we didn't have a sustainability plan. So when the teachers were leaving, pain is not an easy topic to teach teachers. It just, I was not being very realistic about it. So I was all over the place. So anyway, we developed that. Then what happened was we took that material and took it to different schools in rural where I was working in Lebanon, and we tried to use that with the teachers over there. And then we got hit by COVID. But I knew that this information was important. It was just that we could not use it to teach the students. We had to work with the teachers. So we applied for another grant. And because of COVID, we got a lot of funding from the federal government. We got a grant. And so we created an online curriculum, complex topics, and we had a team of about 25 healthcare providers, behavioral health, people with different lived experience, high school kids, and different ages and different ethnicities, and we also had different gender identities. So we had a very diverse group, and so we created this online curriculum, and we call it Easy to Care. And we said, oh, we're going to take it to the school district. We're going to teach the teachers about this, how to take care of their health, because if the teachers know how to take care of their health, they can help the students. And oh my goodness, we could not make it fly. We had this beautiful program with this product, and we could not make it fly. So another failure. So we went to the school district, and I tried every single way, because that was my community health, population health. Let's do it before they get into healthcare upstream. Nothing happened. So I said, okay, well, we have this beautiful product. We have to use it somewhere. So one of our physicians, Dr. Jones, he is a rheumatologist, and he and I have been talking. I used to do a group class in healthcare from a PT standpoint, because I understood that social connection is a very big piece of healthcare, right? You have to be in a tribe, and what better to have a tribe with people with chronic pain, because you're so isolated in that process, right? You're so isolated. You're so hard on yourself. So that is when he said, let's do this. So we had to wait 1 year, because healthcare. So we had to go through gazillion committees and whatnot, but we are in process. So what we do, we take a group of patients with rheumatoid arthritis, and his practice, they pick the patients. So he made a video of his own, so the patients get to watch that video, and he explained that this is not just skill. Like, you're not here just to gain skills. You're here to do a deep healing, and it's a lot of work on your part. And he explains it in a birthday cake analogy, that how you can mean you're in survival, and then you go into recovery, and how you start thriving. So and how the immune system and the nervous system and the endocrine system are all connected. So they watch that video, and then they come to the class, and we meet once a week for 8 weeks, and it's just him and me. And it's a pilot right now, but we are doing research. We are looking into data to see, and he sends me this text of his patients, because I get, after the 8 weeks, I am done with them, but they have an online platform where they can meet as a group, so they can communicate with each other on this online platform. So we're in our third cohort. And we use the different pillars of lifestyle medicine. So that is physical activity, nutrition, sleep, stress management, social connections, and reduction in substances. And we use a lot of acceptance and commitment therapy, behavioral health skills for them to have in their skill set. And I don't use the word tools. I prefer the word skills, because I feel like tools are something. If I have a hammer and I'm using the hammer and the hammer breaks, my tool broke, and it's not working anymore. But if I give them the skill of hammering, then if the hammer breaks, they'll get a rock and use that to and skills are something that is always going to be with you. Nobody's going to take that
Point.
away from you. So building that skill set and repeating it over and over again, so they have, when they leave after 8 weeks, they have enough skills that they have practiced during our
I would bet that these people in that pilot program getting all that those different branches of attention have to absolutely have improved symptoms with RA and a much better lifestyle. I would just bet.
Yeah, we are betting too. So we're collecting data and
Yeah.
we just
I'd
got
love to see that because,
Yes.
RA is one of these on the fence diagnoses that all of our doctors are saying are not neuroplastic, but we are meeting people that are in recovery. And all the doctors are also saying, including Alan Gordon, and I know Dr. Hanskin will stand up on this, that if they have an inflammatory, process that's chronic, it can absolutely respond to these neuroplastic strategies. I mean, and I've met people, so I that's why I feel like RA is one of these, especially because it's an inflammatory process, and there's still a root of why the body's creating inflammation in that particular joint. That's me on the fence.
So I think
Me on the limb.
no, you're not on a limb. You're on the right track. The
Good.
problem I have, and I'm going on a limb here because I
Please.
am challenging a lot of the bigger
Please.
people here. I think there's a problem with the classification of pain. When you use a classification of nociplastic, neuroplastic, and what is the other one? No. So we have Nasi, no. So there's the neuroplastic, and nociplastic, and anyway, I have a problem with that classification because what we're telling is, oh, it's the inflammation that's causing the pain. It's this that's causing. Oh, it's the nervous system that's causing the pain. It's this that's. So we are saying that this is the cause of it. So we're not using the term contributors. So when we were doing our Oregon Pain Summit, we came up with 3 takeaways. And that was, all pain is pain. Doesn't matter what your diagnosis is, pain is pain. And they will all respond to what we have been talking in the last, how much ever time you spent. So all pain is pain. And that has multiple contributors. All pain is real. You're the only person who can say they're in pain is the person suffering. And so it is not our job to ever question that. So that is like, I believe you are the 3 words that if every healthcare provider can just embody, that will change our healthcare dramatically. Right? So it's none of our business to question the person sitting in front of you that your pain is not real. You're faking it. I don't care if they are an opioid. They are using opioids for whatever they're using it for. Why are they taking opioids in the first place? They were taking opioids because they were in pain. So please, let's accept the fact that they're in pain. Whether that pain is emotional, has a strong emotional contributor or social contributor. Right now, when I ask my patient, what are the stressors in your life? What are the 3 top stressors in your life? The things that are happening in the world. Are we going to deny that? No. Our world is right now in chaos, and we will accept that is contributing to our pain. So that's the second part. So all pain is pain, all pain is real, and all pain can change. And that is where the hope comes in because of neuroplasticity, because the nervous system is so adaptable that we can retrain our brain and retrain our emotional responses if we start understanding how this whole thing works. And it can
for
be
any condition. And I've met people from every walk of every label. So for me, it's about the relationship with your body and the individual, the decision they make, the hope, the belief, which is a whole nother broadcast. But I love that. I love that because we are inspiring people that they are not special. no, because people are like, but I'm someone different. My doctor missed it. He missed the diagnosis. And this is back to the giving the doctor power.
Yeah.
What you're saying, Sharna, is anything is possible. Any healing is probable. It depends on.
It depends on what you said, your relationship with you, and finding a person, a coach who can understand these concepts. If the definition of pain by the International Association of Study of Pain, and I don't want to get into the whole definition, but the first line, pain is a sensory and emotional experience, period.
I love it. I love it.
So if we can it's an experience. So what are we chasing? That yes, in order for these doctors to diagnose, yes, you have to do the inflammatory markers. You have to do this. Yes, that's fine. You can take your time diagnosing, but the treatment remains the same. The validation, the empowerment, the autonomy, the agency, the understanding of pain, that's just,
And
I do.
I will add in something on that because I think, and sometimes people have to break the habit of being their self, but that's another topic because we have to evolve. We have to evolve and accept and, So Jeannie, did you want to comment on, because Sharna's just unpacking some amazing stuff. Did you want to make a comment before I bring up this question?
Yeah, I mean, again, this is all based on neuroscience. This is all based on science, right? So I just love, maybe after these questions, we'll kind of go into, nocebo, placebo. This is based in science, neuroplasticity, people who say they can't change their brain, they can't change their thoughts, they can't bring down the fear. That's not true. Neuroplasticity, that's neuroscience. So just highlighting everything she's saying, of course, it's all evidence-based. So that's why we love it.
Highly evidence-based. It's highly evidence-based. It is not, we are not talking just blah, 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 blah. There is so much evidence. And that,
Beautiful.
Thanks, Jeannie.
Okay, here's the question for you, Dr. Sharno. Some days it's hard to believe that all pain is the same because I've been doing all the work, feeling my emotion for years with no results. What else should we be looking at, contributors?
So, okay, I am not your coach, but I am going to make a suggestion. So there is this book. It's called Pain Management Guidebook. It's on my website. It's a free download. It's on solace.com, knowledge base. It's a free download. It has been beautifully written. It's very, it has a very easy read. It has cartoons and it explains basic neuroscience very simply in a very layman term. So this is how I treat my patients. I do a complete history. I do a complete evaluation and I tell them that, okay, you know what, this based on my evaluation, I find this, and this, but you're doing really good with this. You're really good with this. Your strength is good, but what you're struggling with is pain. So I'm going to give you this book. I have copies of this book in my clinic when I work as a PT, but as a coach, I just send them the online version of it. I said, I want you to read this. I want you to read it twice. And on the back page, I want you to write down what are your aha pages and what are on the other side, right? I don't get this. I just don't understand what they're saying. And on the bottom, is there something new I learned? So and if I see my patient walking in with this book in their hand, I know that they're going to be better in 5 to 6 visits at the most. And I'm not saying all patients get better that quickly. Some of our CRPS, some of our very complex patients do take longer. I have seen patients for up to a year. So no, I'm not saying that all patients get better that quickly, but I will say that if you get the science down, if you get the neuroscience down, and that's a very strong foundation, then you can build upon all the other contributors. Answered Patty's question.
Well, I would like to just add, and I think I've met Patty here before, and Patty, sometimes we have to hear it again and again and again in my life, in Jeannie's life, But I'll always quote Dr. Clark, who I've often asked him, okay, doc, some people are doing all the work. And what is it? They're not victims of God's not against them. Why are they not recovering? And he'll say to me, Tovah, there's still something in their brain, in their nervous system, that believes that there's a threat. There's still something that they have to deeply understand about the relationship between their conscious and unconscious mind. They just have to stay with it and go deeper and look deeper and maybe what I call face the lion, face the monster under the bed, which is usually that's another way that we can say, like, don't give up. There's something there. I mean, Jeannie, what would you say to that, to Patty's answer?
Yeah, just like we echoed before, we'd have to hear things again and again. And the way I like to say it, if things aren't changing, first of all, sometimes we think, just to say this, because this was true for me, we think we're doing the emotional work, we're not feeling it. Sometimes we're in the story, we're crying over the victim mindset. So since we don't know Patty, sometimes we're not actually in the body feeling it. So the three things, it's like we talked about with Dr. Sharna, our relationship to ourselves. There might be harshness, self-judgment, not forgiving ourselves. So it's the relationship with ourselves. It's the relationship with our symptoms. Sometimes there is fear, frustration. We're fighting it. We don't realize, right? And then our relationship with others. So are we still people pleasing? Are we doing things out of guilt or resentment? That's what I would offer. And then I always offer the 7 F's when people don't know. If you look at that, it's pretty much in your face. And that's from Dr. Schubiner, like
Rubina.
fear, figuring it out. Yeah.
Fighting
we
it,
can, link that.
focusing it.
Yeah.
Yeah.
Another
Yeah.
tool I use is a weighing scale, and that's from Lorimer Moseley. And Lorimer Moseley talks about he calls it DIMS and SIMS, the danger in me and the safety in me. And in some people, the danger might be very heavy. Things that have happened to us, things that have happened to our parents, things that have happened to our grandparents, and everything else that has happened. So that could be the danger. But the safety side is what, Patty, you might be doing is, I've been doing all this emotional work. I'm doing that. But the scale might have tipped, but the scale might not have completely tipped. So there might be other safety skills that you need in order for the pain to shift. And Lorimer uses the term that this danger in me is sometimes in hiding in hard to find places, like what Tovah said, that the monster under the bed that is hiding and you don't even know that is there. So it's just gradually working on each one and seeing, and before you know, you made all the progress, and over time it will shift, because you got to trust the neuroplasticity. You got to trust in the science that there is hope. And I'm not here to say that. And can we just accept the pain where we are? And that word is very hard for people to accept that word. But it is. If you have a beach ball, right? And you take the beach ball and you push it in water, what's going to happen? It's going to bounce back. So the goal is you take that beach ball with you wherever you go. And over time, that beach ball, it's not in your face the whole time. It becomes part of your it's part of your life. Yes, it's there, but your life, your function, your living a life of value and purpose it continues, right? So
Yeah.
you can still do that with pain. Yes, today's a bad day. I'm going to take it easy and I'm going to do what I need to do. So it's hard to answer these questions without really knowing you both, but those are my tips.
Beautiful
that to start with.
explanation. Susan has a question. What about non-pain symptoms? Weakness in hips, tingling in feet. MRI shows severe narrowing and spinal stenosis. I know Doc Sarno says spinal stenosis is normal aging of the spine.
So what I read over here is that yes, spinal stenosis is normal aging of spines, just like osteoarthritis or any of those diagnoses. But the fact that there is weakness and there's tingling, that tells you that there are some neurological contributors to that weakness, right? So that would be something that you would get it checked out with because that is not pain. So we're talking pain right now. So pain is, so I'll give you a story, really quick story. Do we have time for that,
Yeah,
Tova?
yeah, absolutely.
So I had a patient who came in his he was in his late 60s, and he came in with with pain in his low back. So I said, so tell me about your pain. And he goes, I have spinal stenosis. So I said, oh, okay, what do you understand by spinal stenosis? He says, it's the narrowing of my spinal canal. I said, okay, and what does that narrowing do? So it presses on the nerve. And so, and what does that do? And so it's going to press on my nerves. And what is that going to do to you? And he said, that's going to paralyze me. And that is going to put me in a wheelchair, like my mother in a nursing home, and nobody will want to come and visit them. So that is the meaning of spinal stenosis for him.
Yes.
You see how this works? So I evaluated him. I had him on the floor. I had him stand up, and I called this clinical theater. I know it sounds kind of, maybe not, but it's clinical theater, because in theater, when you're sitting and watching a theater, you don't know which dialogue or which experience is going to stick with you, right? So I do that, and I say, oh wow, you're in pretty good shape. You can get up from the floor. You can do this. You do that. And I said, what's your goal? He says, my goal is I want to get back to woodworking. I want to be able to go back to my workshop and start woodworking, because I've been commissioned to make some picnic tables and I can't do that. I said, okay. So, and I talked to him about how your, your thoughts and your beliefs and your emotions and your body sensations, your feelings, what you feel in your body, they all contribute to your pain experience. So and I said, okay, well, set up a goal that you're going to walk halfway to your workshop, put a chair in the middle, and then, see how it works. So he comes back after 1 week, and I was like, so what's going on? And he goes, I have no pain. I was like, you rarely see patients like that, right? So he goes, I have no pain. And I said, what happened? He said, tell me everything. What happened? And he said, I went home and I talked to my wife about emotions and thoughts and all that. And she was very happy but she said, you never talk about emotions. So that's a good thing. Do what she told you, keep working on it. But that same day, I had my friends come over for beer, and we all sat down, and I told them about you, and they said, oh, did she not do any manual therapy? Did she not do any adjustments? And I said, no, she didn't. So he said, oh, you should change your therapist. This is not the right therapist. You should go. So, and I said, and so what did you think? He said, no, I thought that let me just see what you were doing since we started this. So first day, I just went to my shop. I said, did you use the chair in the middle? And he says, no, I didn't need to. I just got there. And I said, what did you do? I dusted all my machines. And the next day I went back again. I turned them all on, and they were all working. I said, oh, good. And then I said, I cut some wood first day. And then I went back again and I cut some more wood, and I made those 2 picnic tables, and I cut so much wood now, and I've put it on, this website, and people can give orders. I said, really? You did all that quickly? He said, yeah. I said, so tell me what happened. How did this change for you? He said, remember when you had me on the floor and I stood up and you said, wow, you're in pretty good shape. And I realized that I was in pretty good shape. So I said, oh my God. And so in my mind, I'm going, Sharna, talk relapse, because, this is like magic, right? How did this happen? And I didn't do anything. He said, so I said, okay, here's what happens. Sometimes things, change, but your pain can come back in this and that. And I said, okay, I'll see you in 1 month, because I want to make sure you're okay. So 1 month later, he doesn't show up. It's a no-show. And I hate no-shows, because I get so involved with my patients, and like, how do you dare you no-show me, right? So I call him up and said, hey, what's going on? Where are you? And he goes, Sharna, I am loading sheetrock. I don't need your help. You go help other people. I am fine. And I was like, oh my God. So you see, so as far as answering the question here is, I don't know the weakness and the tingling, how that's what is going on over there neurologically, because I would have to do a full evaluation to assess that. But this was my spinal stenosis story, and it
Right.
is.
Well, I would like to say, and I'd like to hear Jeannie's opinion. I would like to say to Susan that in the PRT work, specifically, it's also called sensory reprocessing therapy. It's not just pain. We're looking at the pain and the sensations as the same from the pain processing therapy point of view. And as a chiropractor for 41 years, if you're having pain or tingling or numbness or warmth or temperature changes, something in the something in the nerve, something in the way the nerves being compressed or, but it doesn't change things for me regarding my treatment. We're still talking about the players, the factors, the root, the cause, the contributors. So Susan, I wouldn't recommend that you separate yourself saying that, well, I have sensations. And to me, it's the same. Sensory reprocessing, pain reprocessing, neuroplastic, the brain, your relationship with your symptom. You can get into understanding what the nerve is doing and how it's pinched, but I wouldn't separate it. And I don't think anybody in our field would make a point to say, oh, the sensations are different than the pain. In general, that's my point of view, to just because I'm not sure exactly what you're asking. But Jeannie, what's your experience with just pain or symptoms or sensations?
Yeah, I mean, the same as you. There's so many. We know there's so many skin conditions that are very symptomatic of TMS, right? Neuroplastic. So psoriasis and what's the other one? There's another one. I can't think of the other one, but like skin conditions.
Eczema.
There you go. Yeah, and like, IBS, being constipated, sometimes it's more bloating. It's not like pain or, digestive issues, or there's a lot of things, having anxiety. Sometimes it's not pain, it's just uncomfortable, right? So we know there's just so many, but I think that gets caught up in the whole, what Tovah and I were talking about, Doc Tovah, like I'm separate, but mine is different. Okay, yes, back pain is the most common, right? But we can't, I always tell people, like, my worst TMS symptom was ankle pain. No one's ever heard, there's no book, there's no coach talking about that. I didn't care. It doesn't make sense. It fits the profile.
Yeah.
And just like that light touch too, right? Like that light touch or the burning sensation, right? That all is indicative of TMS. So we need to care less about who has the symptom. I can't work with them. They don't have exactly the same symptom.
Yeah.
It's all, you might just label. I don't even talk about symptoms. For me, it's TMS. Someone else might use it's all neuroplastic. It's just so much more helpful, because then you can focus on what it is you need to do, which is getting better, and not on the specific symptom.
Good point. Good point. And, in closing, we have a few more minutes, and I would love to hear, some inspiration. I mean, you've been leaving it in pixie dust throughout the whole hour, Dr. Sharno, the different inspiration. But maybe what would you like to say to some of the listeners, how you would inspire me and leave hope to the people who are maybe stuck or not recovering or with complex symptoms, who are just, struggling like Susan or Patty.
I will go back to my 3 sentences that I said, that, your pain is, all pain is pain, all pain is real, and all pain can change. We have multiple contributors to our pain experience. And, what you guys were talking about, the sensory aspect of it. Yeah, that sensory aspect can be processed, reprocessed. That is data. Your sensory information is data. So it's up to us to listen to the data and see how that works out. Because I have so many skills I use in that sensory space, and see which one works for you individually. The easy to care curriculum that I was talking to you about is available online. So if you feel like having someone as a coach is too much, you can just go take the course online and see if that gives you enough skills that you want to navigate through in your life. But I want you to know that there is so much hope for chronic pain that we cannot just sit and say, accept this as your reality. And for some people, the chronic pain can, like we talked about, it's neuroplasticity, it's going to change. But your main thing is, are you living a life of vitality and purpose? And if you're not able to do that, then please find a coach that is local in your area or online or whatever it is that works for you.
Well said, and beautiful that you repeated those 3 things. It's very important. I've never heard it said like that. So we're gonna have it on the record, and I think I saw Jeannie write it down. Beautiful to hear your language, which is our language, but to hear a little different flavor from Dr. Sharna, from your experience, from your, background. Really, you've shared such beautiful pearls of wisdom.
Thank you. Thank you for
Really,
the
really.
opportunity to
Yeah.
chat with such wonderful people and,
Yeah.
your platform, whatever, I highly appreciate the opportunity.
Wow.
Thank you for that.
Wow. So good night to the listeners. We'll see you next week. Jeannie, thank you so much for sitting with me here. And Dr. Sharna, have a wonderful, blessed day. Thanks again. All the best.
Bye.